Well, hello, hello, hello. Good evening, everyone, and welcome back to the show. You guys tell, I have fun when I listen to that song. I had somebody say to me that it makes them think that they're on the beach. I guess that's what I'm thinking. Well, anyway, welcome. This is Dr. Dwayne Wood. That's Wood with an E, and the E stands for endocrinology. Here on this channel, we help to educate, empower, and encourage you to take charge of your health, take charge of your life, avoid complications, and live that healthy, fulfilling life that you have always wanted. That's what we do here on the show. We are glad that you're here. Hopefully you had a great weekend and a great Monday so far. I know we did. It was fun. We had a birthday party that we went to and all kinds of different things. So glad that you're here. If you are new to the area, if you're new to our channel, go ahead and put new in the comments because we love to give you a hand clap and welcome you to the neighborhood, welcome you to the channel. If you have questions as we get throughout the night, we are going to answer those. So go ahead and put the Q in front of the question. Tonight, we're talking about two topics, actually. We're smashing those topics together, diabetes and dementia. And the question is there a link? And you guys saw, let me see if I can come back there and pull up our little graphic. You guys saw that graphic that we had. And it is one of those questions, right? Is there a link between diabetes, and is there a link between diabetes and dementia? And so we're going to answer those as we get into the evening. Let's see. We've got Tammy Jordan. Hey, Tammy, how are you? Welcome. Ooh, let's go ahead and give you a little hand clap. Woohoo! Glad that you're here. You guys know I always do a shout out. And tonight, the shout out is to the Birmingham Zoo. I told a story about them last week, if you remember. That was a story about wearing the different hat. But it was a good learning experience. How about that? Right? So I had fun. We had fun down there and a good learning experience. And I was able to use that. I'm always looking to see what can I learn from different experiences that I have. And that was a very good one. So if you were here, glad that you were here and you heard that. If you weren't here, go ahead and listen to that on that was last week's video, last week's show actually. If you are here, if you have not already done so, go ahead and check us out on all of our social media platforms. Subscribe and follow us. We've got LinkedIn, TikTok, Buy Me a Coffee, Twitter. Instagram is not there, but we also have an Instagram account, and that is Dwayne Wood MD, just like all the others. Of course, here on our show every Monday night at 7 o'clock, we have exclusive health and wellness talk, and we are glad that you are here. Go ahead and send a link to a friend, a family member, someone that you think would benefit from this. Our pastor usually say, if you're a Apple apostle or an Android, go ahead and share this with everybody. Also, remember that we do have our coaching program that DwayneWoodMD.com, DwayneWoodMD.com, and we would love to partner with you. Sometimes people just feel stuck. They feel that there's something else they want to do, but they're not sure what it is. And we would love to partner with you. I can help you get to the next level, right? So that's what we say. That's what we want to do. We want to be a part of your community. Link between diabetes and dementia. Is there a link between diabetes and dementia? Well, let's get to it. Now, first, I want to tell you a story. I want to tell you a story about this wonderful lady that was a part of my life, part of my family. This is my grandmother. And dementia hit our family because at one point, She knew us, and then she didn't know us again. And probably the most difficult time for me was, I remember my wife and I had gone to New York, and I went into her room where she was, and it was late, and she recognized me, and we talked for a couple of minutes. Dwayne, right? Hey, Dwayne, how are you doing? And then just as quickly, she didn't recognize me again. And as I think back now, I think that was probably the last time that she really recognized who I was, and I was able to have a conversation with her. Now, this was a lady who read to me at night. This was the lady who taught me Bible stories. This was the lady that took me to church. This is the lady that cooked and cleaned. This is the lady who took up for me when my grandfather, right, when I did something wrong. She was the one that was there. And to now be in a position with her where she didn't know who I was. And some of you are out there, and you have family members that that have gone through this, or you may even right now be going through it. And so my heart goes out to you. My thoughts are with you, because I know it's not easy, right? These vibrant people, these significant people in our lives, and then all of a sudden they're there physically. Right? They're there physically, but they can't engage with us like they used to. So dementia is a term that we use. It is not a disease on its own. It's a term that we use that signifies some impairment in memory, in thinking, in the ability to take care of normal and everyday activities of daily living, like we call ADLs, right? Activities of daily living. So that is what dementia is. It is that combination of things, and there are other things that we'll talk a little bit about as we get into the evening as well. But that's the core, right? So impairment in their cognitive ability, impairment in their memory, impairment in their ability to take care of just their normal daily activities. Now, some of this happens, right, in a small sense. So as we age, our muscles get weaker. We may be a little bit more forgetful. We may not be able to do some things, right? But dementia takes this to a next level. So dementia is pretty common, and we've talked a lot about diabetes. So I'm just gonna breeze through diabetes, right? So we know that there are 422. As a matter of fact, the last statistics I saw, 463 million people around the world, right? Almost 500 million people around the world with diabetes. 37 million in the country alone. 88 million in the United States that are suffering from prediabetes, right? So we know those numbers. For dementia, around the world, there are about 55 million people that have dementia. In the United States, between 4 and 5 million that have dementia, and it is growing. The estimate is that by 2040, I think is what it was, 78 million people and 158 million by 2050. So it is growing. It is a huge issue. And most people, right, even though you can have dementia at any age, most people that have dementia are 65 or older. Okay. It's not uncommon to have dementia below that, but most people are 65 or older. Now, one of the questions that comes up right away, and let me just go ahead and answer it. Dementia is not a normal process of aging. Now, one of the risk factors, and we'll go through some of those, one of the risk factors is getting older, but it is not a normal aging process. It is not one of the things that you should just expect that's going to happen just because you're getting older. That is not the case. Okay. And if you're in a situation where people are telling you, oh yeah, you're just getting old, that is not the case. Okay. Because there are millions of people who are over 65 and they don't have dementia. So just wanted to throw that in. Probably a little premature for what I'm saying, but that's okay. And so dementia around the world is the 7th leading cause of death. Number 7, 1, 2, 3, 4, 5, 6, 7th leading cause of death around the world, right? That is huge. Okay. What are the signs of dementia? And we mentioned some of them. So memory issues, problems with completing tasks, right? All those activities of daily living, just their cognition, the ability to think through a process. You may find that in some cases they begin to withdraw, and they withdraw for lots of different reasons. A few of them being that sometimes people who have dementia, they're aware that something is different, right? Maybe their words don't come as easily. Maybe they're forgetting little things. And so rather than be in a social situation where they know they're not as sharp, they begin to pull back. Okay. So that's one of the symptoms there. Getting lost in familiar surroundings. That's a big one, right? So you go to the grocery store, or you go to the mailbox, right? Or you're walking down the street and all of a sudden they don't know where they are. They don't recognize where they are. And then, of course, recognizing faces, right? So people that are normal in their lives, then those people are strangers all of a sudden. Okay, so those are some of the common symptoms or signs of dementia. And as I mentioned, dementia is not a part of normal aging. All right, millions of people are growing older and getting over 65 and still not having dementia. Okay, so there are some risk factors, and I'll talk about those here in a minute. But first, I want to go through just a few dementia. Right, so there are. When we talk about dementia, it seems like we lump them all into a category, but I just want to give you a few. Number one, and this is not in any order of importance. We'll talk about two primarily as we get into the evening, but there's vascular dementia. There is Lewy body dementia. There's frontotemporal dementia, so different parts of the brain. Okay, the Lewy body is a substance that gets that's in the brain. There's also medication or disease-associated dementia. Now, these, interestingly, are reversible, usually reversible, right? So if a medication is causing it, you stop the medication and all of a sudden, grandma, grandpa, auntie, mommy, daddy, they all of a sudden, it's like they're back to normal, okay? So that is an interesting one. In our area, for me as an endocrinologist, hypothyroidism, right? So remember, hypothyroidism slows everything down. So someone who has hypothyroidism, right, it also affects the brain. So it slows everything down. So sometimes treating the hypothyroidism makes a big difference in those folks, right? So remember that as you go through. And then, of course, the one that everybody hears about is Alzheimer's disease, or Alzheimer's, depending on how you pronounce it, where you're from. I don't know. What do I say? Alzheimer's? I don't know. I got to say it a couple of times. So you guys tell me, what do I say? All right. So those are the types. Now, risk factors for dementia, and we mentioned age, right? So 65 or older. Family history. So if you have a mom or dad, brother, sister in your family who has dementia, then that increases the chances or the likelihood of having dementia. So there is an ethnic component to this. So African Americans are twice as likely to have dementia compared to their white counterparts. The same thing for Hispanics. They're 1.5 times more likely to have dementia compared to their white counterparts, right? Poor health, right? So hypertension, hyperlipidemia, smoking is one of those. And here are two that are very, very significant for us during this time of pandemic, right? So depression and isolation are risk factors for dementia. Yeah, those are very interesting ones, right? Because we have been essentially isolating for 2 years, right? I cut off the beginning and the ending of it, right? But yeah, so isolated for about 2 years. So depression, we're seeing more depression because of the pandemic and because of everything that we've had to go through, and also isolation, right? I can't tell you the number of patients that have come in to the office, and that's their issue. Nobody comes by. Nobody's been coming by. Nobody, their family members may drop food off or get food delivered, but nobody was coming into the house. And you know how we like to do, particularly here in the South, we like to sit and we like to chill a while. We like to hang out. Okay. So those are risk factors that we also have to remember. So Alzheimer's is the most common. It is the most common cause of dementia. And between 60 to 80% of everybody who has dementia, it is due to Alzheimer's. Okay, I guess I do say Alzheimer's. Okay, so 60 to 80%. There's another dementia that we're going to talk about, and it is vascular dementia. So let's go ahead and talk about that. We'll come back to Alzheimer's because that one is one that's going to be very important as we go into our discussion tonight. So vascular dementia, is the other one I want to talk about. Vascular dementia. Now, we've talked about the effect of blood sugar on our remember the triopathies, right? So nerves for the feet and hands, kidneys, nephropathy, and retinopathy on the eyes. But remember, in I don't know which one of the videos that I did, I said that we need to also know that it's not just those 3 areas that are being affected by the blood sugar, okay? Every cell in your body, if you're diabetic, every cell in your body, and if you're pre-diabetic, right, every cell in your body, and if you have insulin resistance, every cell in your body is living in that milieu, or that soup, right, that metabolic soup, if you will, where you are. So it's not just that those are the 3 areas that are affected. Those are the 3 areas that are more commonly affected by blood sugar. But the brain is one of those areas as well, right? And the brain is the ultimate in neural tissue, right? So nerves, that's where they all start, in the brain. So for this vascular dementia, right, what begins happening in the brain is the same process, we believe, that's happening in peripheral nerves, right? And in peripheral vessels, because remember, there are vessels and there are nerves in the brain. And so the high blood sugars, number one, can damage the vessels, right? So it damages the vessels. And so we have little breaks in the vessels in the brain. Not so much that they're causing a stroke or that they're causing this big bleed, but just that little area that didn't get enough blood, didn't get enough oxygen, that little area, those cells, those small little cells, they begin to die. And what's running through those cells, and what are those cells, right? So those cells are neural tissue, nerve tissue, right? Remember, the brain has all these different areas that are responsible for our emotions, right? How we feel, for cognition, how we think, for our speech and our hearing, our language. So our personality. So all those things are there, and our memory. So if we're damaging vessels that are supposed to go to areas that are then responsible for memory and our thinking and our, all the things that we do, the ADLs, or activities of daily living, if those guys begin dying, right? And it's not like all of them die at one time, right? So we have little cells that are going through this process, and this one goes and that one goes. And after a while, they add up. And so we have what we call vascular dementia. Not only the vessels, right? So we talked there about the vessels, but the sugar, the high blood sugar itself, damages the nerves, damages the neural tissue, right? And we talk about the fact that these tissues are where all of the webs, right, that are coming together to form different thought processes. Do you know Do you know that everything that you have ever learned in your life is up in your brain? That's right. Everything is up there. It's just that there is not necessarily a ready connection to it. Right? But have you ever had this happen to you? Okay, this has happened to me. Right? So there's something that you're not even thinking about something. And somebody says a word to you or tells you a story, or you have a smell or taste or a feel, right? Or you go into a situation and you're like, oh, and then all of a sudden the memory comes back. That happened to me recently. I went to New York to visit, and my sister picked me up from the airport. And so she took me around and we were driving around our old neighborhood. I have not been there in years. And particularly, I had not been to the library in our old neighborhood, right? I was 7 years old. I think, yeah, was it 7? Yeah. My dad took us to the library, and he's like, okay, you guys get library cards. And so that's when I fell in love, by the way, with Curious George and the man with the yellow hat. That's a whole nother, that's a whole nother conversation. But anyway, so she picked me up. So we're driving around the neighborhood, and she said, hey, do you want to go by the library? And I said, sure, right? And so she's telling me these stories about, she's older than I am by a couple of years. And so we're driving, and we stopped in front of the library, and I got out, and it was closed, but I stood in front of the building. And when I stood in front of the building, there are these stories that came popping back. Yeah, they're there, right? But the ability to access them. So can you imagine then if those cells that are supposed to make those connections begin dying, and there's not a ready way to make that connection, and so that memory goes away, or the ability to access that memory goes away, right? So vascular dementia. That's one of those things that happens because of diabetes. Right. So the high blood sugar. The brain is probably one of the highest, I shouldn't say probably, the brain is the highest consumer of the energy that comes from glucose. Because the brain can only use two things, either glucose or ketone bodies, right? Those are the only sources of energy that the brain can use. So if your blood sugar is high, the brain, right, begins absorbing that, and it sucks it in and it stores it. And that high sugar is then toxic to nerves and vessels and so forth, right? So vascular dementia. That's one way that diabetes can cause dementia. The other way that diabetes, one of the other ways that diabetes can cause dementia, right? And so this kind of bridges between this vascular and what we're going to talk about here in a minute, Alzheimer's disease, is that we talked about the hyperactivity, right? So the brain has this ability to use sugar, and so the sugar's there, is being stored, the brain is burning it up. But insulin resistance. Remember we said that the tissues of the body, right, all have this insulin resistance. And so imagine if the receptors that are supposed to be using insulin also in the brain aren't functioning well. What begins happening in the brain? The blood sugar gets higher and higher and higher. Why? Because it can't get in. Right? So that insulin resistance can cause issues in the brain as well. Okay? All right, so let's switch over for a minute and let's go over to Alzheimer's. But let's see, I think I saw Dr. Charmaine is here. Hey, Dr. Charmaine, how are you? Glad that you are here. Glad that you are here with us. And there you see, it says good evening. Good evening to everyone. All right, so Alzheimer's disease. So it is the most common, right? 60 to 80% of everyone who has dementia is due to Alzheimer's disease. And we've talked about the numbers. There are two things that I want you to remember about Alzheimer's, right? And we believe this is not all of the pathology, but there are two proteins beta amyloid, and tau, like wow, tau, T with a T, tau proteins. And we're going to talk primarily about the beta amyloid because it is known that in diabetes, type 2 diabetes, there's amyloid that's being deposited in the pancreas, right? Amyloid being deposited in the pancreas. And amyloid, we believe, is one of the reasons, one of the pathologies behind Alzheimer's disease, right? It is the fact that these are amyloid plaques. It is the fact that these plaques somehow damage the cells. Because remember, the cells in the brain are like these little factories, right? And they get stuff in, they do something with it, and they send the stuff back out. And the stuff that I'm talking about are these signals, right? Signals, for one, that are going in and out. Also, the nutrients that are needed back and forth, right, into these little cells. And the amyloid gets into the cells and blocks that. And so the cell dies. Once again, we're talking about the cell death, right? We talked about that with the high blood sugar. But the cell dies. And if that cell dies, what happens to the connection, right, from one location to another, where there's a memory that's being stored or supposed to be stored or supposed to be accessed? So the belief is that insulin is the responsible party for that. So insulin, so higher insulin, right? We talk about insulin resistance, right? And let me jump in here really quickly and say this, right? We're talking about the connection between diabetes and dementia, right? But in this pathology, notice that it is not even the blood sugar. It is the high insulin that's causing the problem. So even if you are not diabetic by definition, if you are pre-diabetic, remember, we think that pre-diabetes is an insulin issue, right? So that whole pre-diabetes, right? Pre-diabetes, so the insulin levels are higher. So if you are having higher levels of insulin, even if you don't have the diagnosis of diabetes, then that puts you at increased risk for Alzheimer's disease and dementia. So it's not just, well, oh yeah, my blood sugars are good. When I say good, they're not diabetic range, but that can also be an issue, right? The whole metabolic syndrome, right? So a lot of people who have metabolic syndrome, they have hyperinsulinemia. And so that now puts them at increased risk for Alzheimer's and then dementia, right? Or Alzheimer's and dementia, right? I was trying to make a distinction there, but we'll just say them together, okay? So yes, so the higher insulin causes the buildup of these plaques, beta amyloid plaques in the brain. There are also these tangles. We talk about the tau proteins, but those are generated at higher levels, right? And if you read the studies, people who have diabetes are between 6 and 10 times more likely, and some studies actually even higher than that, more likely to develop dementia. So the chances of developing dementia if you have diabetes is 65% higher. 65% higher than someone who doesn't have diabetes. That's huge. Huge number. And so then the question then becomes, what do we do? Right? And that's why for you, if you're out there, I don't want, as we talk about disease processes, I don't want the disease process to be the end all and the be all, right? So that's not where we hang our hat, right? We talk about the disease process because, right, we want to be informed. But then the question becomes, okay, what do we do now? All right. What do we do for this disease process? Just a couple of other points before we get there. So Alzheimer's has a lot of physical social, economic consequences. A couple of weeks ago, we talked about the true cost of chronic disease. This is another one of those chronic diseases that we can throw into that pile. Okay. So it's not just the person that has the Alzheimer's disease or the dementia. It's not just the loss of their functionality, but then somebody's got to take care of that person. Okay. So that's a cost as well. Right, the loss of that person in their community, in their family, in society, right? That's a big one, right? So that's a loss. So once again, it is a magnified loss. Okay, all right. So I think this is a good place for us to do another station check and another talk about. The fact that we are so happy that you are here. Remember our show every Monday night at 7 o'clock. 7 o'clock. Love that you are here. Please check us out on our social media platforms, LinkedIn, TikTok, Twitter, and then Instagram. And then we're going to come back in a little bit and we're going to talk a little bit more about the coaching because there's some special thing that I want to tell you about there. Okay. All right. And why don't we right now go ahead and let's do our thought of the day. All right. Our thought of the day has to do with mindset. Mindset. What is a mindset? I looked it up, and Merriam-Webster says that mindset is a mental attitude or inclination. A mental attitude or inclination. It goes on to say that the mindset is a fixed state of mind, right? Mindset. So it's set, a fixed state of mind. I'd like to add a couple of things to that, right? Number one, I want you to think of your mindset as the fuel for your goals. Fuel for your goals. Okay? Mindset, fuel for the goals. And the power that generates your forward motion to achieve your dreams. Fuel for your goals and the power that generates your forward motion for your dreams. Now, I agree that it is a fixed mindset. But I think the mindset can change, right? It changes as we evolve. It changes as our dreams change. It changes as our, as the object that we are going after changes and is altered. Okay? So that's the global mindset or the specific mindset. Let me say it that way. But there is a global mindset. And this mindset is just your frame of reference, your frame of mind. What are the rules for your life and for your thought process? Whenever you make a decision, how does your mindset play into that? Or do you even think about it? What rule do you use to govern making decisions? When you are not feeling up to doing something that you need to do to achieve a goal, it is the mindset that gives you the power, that gives you the energy, that gives you the driving force, that gives you the fuel. Remember that? That gives you the fuel to keep going. It is the mindset that allows you, when people around you are saying, okay, man, we need to give up. This is not going to work. We've given it all. It is the mindset. It is your mindset, your global mindset, your determination, your fixed thought process, your fixed state of mind, your fixed inclination that says, no, let's give it one more try. That says, no, I think this is going to work. So the mindset is the thing that we've got to cultivate. Now, I said to you guys several weeks ago that the most valuable thing that you own, was your health and your time. Health and time. Because if you got health and time, right, then the sky's the limit. The next thing I want you to add to your bag of tricks is a strong mindset. And so how do we go about developing a mindset? We go about developing a mindset by feeding it. By feeding it, feeding our imaginations, by allowing our imaginations to expand, by surrounding ourselves with people who are about getting to goals, about expanding their mind, right? So one, feeding it. So we've got to read, we've got to watch videos, we've got to look at podcasts, right? However you consume, right? However you are influencing your mind. And then surround ourselves with people who are of like mindsets. And then try some stuff. Right? Don't just keep putting in it. You got to get out there and do some things. Right? I think it was Diana Gladney who said that, or one of the, I said her name, but one of the podcasters that said that her goal is to do as many things that make her uncomfortable. So as you're learning, as you're changing the mindset, we gotta test it, get it out there, get into the world, allow it to happen. But remember, it is the fuel for your goals. And it is driving force that gives you forward motion to achieve your dreams. So my challenge to you, right, is to work on those three things. Feeding the mindset. Surrounding yourself with people who are of like mindsets and who are about achieving success in their dreams. And then try it. Come back and let us know. Let us know how it's going. All right. I see Dr. Charmaine she said, wow, type 2, 65%, like more likely to develop dementia. Yep. Huge number. Okay. Huge number there. So let's talk about what do we do? What do we do now? Okay, Dr. Wood, you filled us with all these statistics. You talked about all this pathology. So what do we do now? Well, remember we talked about a few things about insulin resistance and blood sugar. So let's run through a couple of those first before I get to what do we do. So we said that high blood sugars damage vessels and nerves, right? Vascular dementia. We said that high insulin levels are an indicator of insulin resistance in the brain. And we said that increased insulin is thought to be responsible for the increase of these damaging plaques. Okay? So a couple of things are happening. So we've got high blood sugar. We've got high insulin. We've got these plaques that are there that are blocking and killing the cells, but they're also generating inflammatory processes, right? Inflammatory markers are going out, and that's causing damage within the brain. And there are these little things within the cells. I'm going to say this word. It's called the mitochondria. You may remember that from your science class, the mitochondria. So as the inflammation happens, the inflammation generates these toxic substances to the mitochondria, which is the powerhouse of the cell, and they die. And when that dies, the cell goes. So what do you think our process is going to be to help reverse that? Okay. Now, going back to a couple of shows, we talked about epigenetics. Epigenetics says that if we treat a mom then we can decrease complications in their child. So once again, we start with make sure that we have good, healthy nutrition for our moms. Because remember, bigger babies or gestational diabetes, right, or obesity all predispose that child to developing prediabetes, metabolic syndrome, and diabetes. And if we say that diabetics have a higher chance of dementia, right? If we start back there, then we're decreasing the chance of dementia out here, right? So that's number one. Being more physically active, right? You guys knew that one was coming, right? Right. Being more physically active. And this one, we are not sure of all the things that happens when you're physically active in terms of dementia, right? But we know, one, it decreases blood sugar. We know that it is a process for lowering insulin levels. We know that it's a process for reversing prediabetes. We know it's a process for decreasing inflammatory markers in the body and in the brain. It increases blood flow, right? So all of those things. And it seems to have an effect in lowering the susceptibility to dementia. Boom. Okay? So become more physically active. Good nutrition. Right? We talked about that for the mom, but good nutrition in general for everyone. Here's an interesting one. The higher the level of education, the less complication we have with dementia. So learn something. Learn something. Take a class. Okay? That's one of the reasons that everyone is trying to get these classes for the senior centers and doing things at the senior home and some of the care facilities, right? Because if we can get them to move and to learn something, then that decreases the dementia. Did we say control blood sugars? Did I say that? If I didn't, let's add that in there. Right? So decrease blood sugars. Treat your blood sugars. Get them under control. 6.5, right, is what we tell patients that they should shoot for as an A1C, right? But if you listen to some of the organizations, below 7, right? Below 7 is the recommendation. Okay? So that's what we want to do, right? So avoid harmful alcohol. What does this sound like? Just a conversation about being healthy? Yes. Right? Avoid harmful alcohol. Don't smoke. What? That helps with dementia? It sure does. It sure does help with dementia. Controlling your weight, controlling your blood pressure, controlling your cholesterol. All of those things are the things that we do to improve dementia. Now, you thought there was going to be some magic wand and some pixie dust or something. Somebody hit you over the head. Now, the reason that is amazing to me, and the reason I love that, all of those things are things that we can do. So the statistics tell us one thing. They tell us, oh, there's this problem that we have. But look at the things that we can do that solves the problem. I love it. And that's why when I come on with these disease processes, I'm excited. Because, yeah, we go through the theory part, but what do we do? That just gets me excited. Because that means there's something that you at home, right? If you're watching this live, if you're watching the replay, there's something that you can do. If you have family members, this is a show, this is an episode that they need to watch. If you guys are going through right now the complications of Alzheimer's, this is a good one to watch. If you suspect that you may be suffering from symptoms, or someone in your family, maybe a loved one, a friend, may be suffering from Alzheimer's. This is a good one to watch. Because even though, like I said, we have those statistics, there are things that we can do every day in our normal routine, right, that are with the intention of lowering our complications for Alzheimer's. Love it, love it, love it. All right, let's see if we have somebody out there. So Dr. C still says about the statistics. Love it, love it. Okay, all right. So this is a good place, guys. So let me do this. I am going to talk to you about what I call my toolbox. My toolbox. So in my office, I have a toolbox that I give virtually to our patients who come in who we're treating with diabetes. And the toolbox has in it all the tools that they need to help them manage their diabetes. Okay. And so we sit down and we go through, and it's kind of like at my toolbox in my garage. I've got hammers, I've got screwdrivers, I've got some nails in there, I've got some screws, I've got a chisel in my toolbox. I don't think my life doesn't really call for chisels, but it's in the toolbox. If I need it, guess what? It is there. And so our toolbox, as we are moving forward in our, like we talked about earlier, mindset, in our mindset change, our toolbox has to be filled with things that we can reach in and grab, things that are helping us along the way. And with that in mind, I have a module, a little video that I've done that we're going to put up later this evening. All right, so that way you can finish watching me right now, a little later this evening. That is a tool that you can put in your toolbox that you can use. And it's a little video that goes through you'll see the topics, and it'll be a few topics as we build out our toolbox. This is the first one in the installment. But it talks to you about, or the series will talk to you about different areas, right? Different gems, different building blocks, if you will. Remember that word, building blocks, that helps you as we, as a group, right, on this channel, move forward as we are building, as we're getting unstuck, right? That's the reason for the coaching program, right? Because we want to help you get unstuck from where you are. And this first one talks about self-talk. It's a self-talk video. And you will sit there, listen, and get a piece of paper, right? There is a worksheet that I have that goes along with it. And I've got to figure out how to get that. If you are interested in that, get that to you. But the video is self-contained, right? Get a piece of paper, right? We have a little discussion on the video, and then you can pause the video, answer the questions, restart the video, listen to the next one, stop it, right? And I want you to, as you're doing this, right? I want you to sit and I want you to really reflect and think about it, because it's going to be so important as we're moving forward. Remember, what are we doing? We're educating, we're empowering, and we're encouraging you to take charge of your life, take charge of your health, avoid complications, live the life that you want, and go to the next level. That's what we do here on the channel. That's our first installment in your toolbox. Okay, it'll be coming here later this evening, so make sure that you get there. And once again, if you have family members that are out there and you want them to come along with us, have them watch the video, or do it with them. That's even better. Get a group of people, all right? Watch the video together, and you guys all kind of sit down and you can fill out the worksheet. Okay. All right. So let's go through, and I want to answer some questions. Some common questions that people have. One of the questions that we have is there a level of blood sugar? I don't have it on the screen. Is there a level of blood sugar? I think I have the wrong There you go. It said Dr. Charmaine Wood on there with me, but it's just me, right? Is there a level of blood sugar that predisposes to dementia? Very good question. And we don't know of a level of blood sugar that does that, right? But we know that high blood sugars do that. So we can't tell you, okay, if your blood sugar is 150 or 160 or or A1C level, that that will cause it, right? We just know that higher blood sugars, uncontrolled blood sugars, will predispose to dementia. But very good question. So the goal then is to really just keep blood sugars within the target range. And you and your physician will talk about what the target range is for you. For most of our patients, 6.5 A1C is what I shoot for, and I tell them, if you look at all the documentation and studies, they'll tell you that they want blood sugars between 70 and 180. I tend to want blood sugars a little closer than that, and so I will tell patients blood sugars between 100 and 120, right, for the general population. Right. As we get older, we may extend that a little bit. And so, for instance, my 95-year-old patient, right, who has some heart disease or some other things, I'm not pushing them down to 100. Right. We may let them stay at, 150, 160 even. OK. So it all depends on what's going on and what the conversation is that you've had with your healthcare provider about where you need to be. Okay. So good question there. All right. Let's see. Another question is, can you have vascular dementia and Alzheimer's disease? And the answer, yes, you can. All right. Because remember, the pathology is different, right? So one, vascular dementia is a dementia where the vessels are being damaged, the vessels and nerves are being damaged by the toxic hyperglycemia. And the Alzheimer's disease is a generation of these plaques and proteins, tau proteins, that are damaging the cells and causing the cells to die. Okay, so it is possible to have both. If you need more details than that, we'll need to get one of our neurology colleagues in. But just let us know, and we may be able to answer more if there are deeper questions there that you'd like to have to know. Okay, very good. Let's see. Here's a good one. So the question is, if I have dementia and I control my blood sugars, does the dementia get better? Interesting question. Once again, you guys always have these interesting questions. And the answer there is, I'm not sure how much better it gets. Okay. Now, we know that we can prevent progression, and there are some centers where they do say that they're able to reverse it. Okay. And I tell everyone that it's always worth a try. Okay. Definitely, we know that if it's a medication or other illness induced, then in those cases, we are sure that, treating the illness or stopping the medication, then that does basically reverse the dementia. So you would have to, and once again, these are specific cases. We'd have to talk with your neurologist. It depends on the extent of damage, where the damage is, and so forth. Okay, so but very, very good question. So here's one. So if let me see if I have. So basically they're asking, when should you be tested? When should you be tested for dementia? Okay. And right now there is really no consensus on when everyone should be tested. But there are some general guidelines. If there is suspicion, right, that something is going on, if we're starting to see some symptoms, then definitely those people need to be tested. And then if there's a family history of dementia, then those folks may consider getting tested earlier. Okay, but there's still a lot of flux in the area about how to do, when to do, so forth. Okay. Let's see. playing word games. So yeah, you see a lot of people. Good question. Thanks. Does playing word games improve or decrease your chances of dementia? So you see a lot of people that are around and they're doing the crossword puzzles and they're doing the word finds and they're doing Sudoku and what's the new one? I just lost it as soon as I don't have dementia, but I just lost the word. But all of those things that help with mental agility, right? They do help. Remember though that the in terms of decreasing the risk long term, it is education, right? It is the learning process. And so, like I said, taking a class, finding a hobby, all of those things help. Now, if we have dementia, staying engaged, right? Staying engaged with crossword puzzles and words and talking to people, right? So that's why it's so important, that community. So sitting and talking to someone who has dementia, very, very important, right? Because that keeps those neurons, all right? Keeps those neurons. And once again, so there's this thing, neuroplasticity, right? So that's the ability of the brain to find ways to connect. Okay. And so that is a very important thing, because we think that as long as we are continuing to engage, right? So, we don't have a person who has dementia sitting in the corner by themselves. Nobody's talking to them. They're not doing anything, but being engaged with them, that really does help as well. Okay. Awesome. All right. Well, guys, I am so glad that you're here. Glad that you have taken time to come on the show. Please go ahead and subscribe to our channel. Join us again next week at our next show. And go to DwayneWoodMD.com. Sign up for our coaching, and then be sure that you work on and do the module that will be coming out later this evening. Okay. Once we get the show out, then I'll go ahead and get that out there for you. Right. So make sure you do that. Drop us a line. Let us know what you think. Let us know some of the answers that you may have as you're doing that video, doing that module, and tell your other friends and families about it. Right. Because it really is the way for us to begin building that toolbox, or putting things in the toolbox as we are moving forward to educate, to empower, to encourage you to take charge of your health, right? Avoid those complications, go to the next level, and live that life that you want. Thank you for being here. This is Dr. Dwayne Wood. That's Wood with an E. And we are glad that you're here. We'll see you at the next visit. Let's get some music and let's get out of here.